all from the Stop TB Partnership. Thank you for joining the webinar, which is for the launch of the new global plan to end TB 2023 to 2030. At the outset, I wanted to tell you a few things. First, there is interpretation available. So if you can go to the bottom of your screen, you see a interpretation like a globe sign, globe. You click that and select your language. If you select your language, you will only hear in your language. So please do that. And I request the interpreters to also write in the chat about this selection of the channels. Second, this event is being recorded, and it is being Facebooked live. So you will be on live on the Facebook. Now, let me start by saying what is the purpose of this webinar. Today, we are launching a new global plan to end TB. This is for the period 2023 to 2030. An hour ago, in a media briefing, this was released to the media. And in this webinar, we will be for the first time, letting you access the new global plan draft. Thank you, Shin, for putting it in the chat. There is a link on the chat. You can click on the link and you will go to the global plan. This is the new global plan. For the first time, this global plan is in digital format, not in the usual PDF or printed copies. This is a new trend, so we are aligning with it. There is also a way to download it as a PDF, but we would advise you to read as much as possible as a digital report, because it is responsive to the screen size, to your computer, to your mobile phone. It also has some added features which will help you in reading, which you will not have if you download as PDF. So let me start by saying that the global plan to end TB 2023 to 2030 is a costed plan for ending TB as a public health challenge by 2030, as you know. It is based on the WHO End TB strategy and aims to achieve the Sustainable Development Goal, Target 3 related to TB. The global plan provides a blueprint of priority actions required and an estimate of financial resources to end TB. The total amount you will hear about the plan in a little while. The total amount you hear will appear to be big. It is actually big, 250 billion with a B, 250 billion US dollar to end TB between now and 2030. But if you break it down, it works out to only $4 US per person in the world per year. So that's the kind of money we are talking about. The global plan also talks about if that money is invested, what will be the return on investment, and also what happens if that money is not invested. So the cost of inaction is huge. You will hear that in a while. I will not go into it. But today we have, for familiarizing you with the global plan and also to get the different perspectives of different stakeholders, we have a distinguished panel of speakers. First, we will have Dr. Paula Fujiwara, who is the chair of the task force, the global task force that developed the global plan. She will go through a quick presentation. It is very difficult to capture the entire global plan into a few set of slides, but she will try to do it as quickly as possible. And then we will hear perspectives from different stakeholders. First, it will be Mr. Obifuna Arinze Austin, who is the vice chair of the Stop TB Partnership Board and also the Executive Director of Afro Global Alliance. Then we will have Dr. Teresa Kasaeva, who is the Director of the Global TB Program in WHO in Geneva. Then we will have Dr. Urban Weber, who is the Head of Department of High Impact Asia in the Global Fund. Then we will have Dr. Sevim Ahmedov, who is the team lead for MNE, TB, HIV, and prevention in USAID Global Health TB. Then we will have Professor David Lovinson, Chair of the Stop TB Partnerships Working Group on new TB vaccines. And he was also a Global Plan Task Force member. Then we will have Dr. Alok Mathur, who is the Additional Deputy Director General, Central TB Division in the Ministry of Health and Family Welfare in Government of India. And we will have Mr. Philip Jacon, who is the Stop TB Partnership Global Plan Task Force member and was representing the private sector constituency of the Stop TB board. So let me first go to Paula. Paula, the floor is yours. Please go ahead. Paula will give us a quick overview.
Thank you very much. Let me. Can you see the slides?
Yes, perfect.
Okay, thank you. So thank you. Let me go into this quickly because time is limited. I'll be talking about the process of development of the global plan, the resource needs. Sahu mentioned the $250 billion. I'll go into a little bit more detail about that. The impact and priority actions by chapter, and then promoting how we're going to promote the global and country level advocacy plans. We need to start by saying that this was a plan that was asked for by the board in November 2020, reiterated in September 2021, a very inclusive process. We had 24 task force members ranging from NTP managers, donors, scientists, modelers, a private sector, community, and economists, for example. Very diverse expertise. We met 10 times. We had 7 regional consultations with over 300 participants. There's a modeling and a costing team that accompanied us, the writing team of which I was the chair. And we had 2 online surveys at the beginning of the effort where we wanted to see how the current plan was being used. And then we had an advanced draft that was looked at towards the end of the process. And we had 166 responses from 65 countries. If we look at the resource needs, TB has a long-term return on investment. And if we look at the world, it goes beyond the 2030 deadline for the SDGs. For the world, there's a $40 return on investment. And if you look at low-income countries and low-middle-income countries, you see that return is going to be even higher at $59 for every dollar invested. Sahu mentioned the resources needed to end TB in this time period. He mentioned the $250 billion, and most of this is going to go for TB prevention and care. With the new issue will be TB vaccination, which I'll talk about more in a second, and then the R&D for new tools. If we break down those resource needs for R&D, you'll see that there is quite a bit needed for all the various components of vaccines in particular. We will be needing $10 billion. In this slide, this looks at the time period between the 2023 and the 2030 and looking at the resource needs by cost category. If you look at the lower band in blue, that is for what we need for diagnosis. The other big band in blue is for the the program costs. The actual treatment costs will be fairly low in relation to the other costs. And you can see this big band that starts to happen in 2026, which is the yellow band of vaccination. And so the costs don't start now, but they will happen once we have the vaccine developed in 2025. what are we going to get for this from this plan? The projected impact by 2030 is that we're going to practically diagnose everyone with tuberculosis. We're going to make sure that we screen the high risk and vulnerable groups, and have 50 million people access treatment. This includes the children. This includes people with drug-resistant tuberculosis, and also have 35 million people access TB preventive therapy. There will be at least one vaccine for widespread use by 2026, having been developed by 2025. And then if we compare it to the 2015 baseline, which is when the SDG started, we'll have an 80% decline per 100,000 population in TB and a 90% decline in deaths. If we look at the global plan by the 9 chapters, each chapter lists key priority actions and what are the advocacy opportunities that come from this. I'm not going to go over every single one, but just some of the high level points. In the introduction, obviously, we're going to introduce the plan itself and the advocacy opportunities with the SDGs, which I mentioned already, the HLM for in 2023 for TB, and also some of the issues around the G20. Chapter 2 looks at the modeling and what are we going to need to scale up to meet the targets, and looking at the advocacy opportunities of what does the country need. And we've done some supplemental modeling around 5 countries in the world. Chapter 3 goes into TB care. The highlight here is that this is a people-centered care approach. Not a patient-centered care, not a person-centered care, but a people-centered care, meaning the whole community. We're also looking for the first time at subclinical disease, and the whole idea is to reimagine TB care. Chapter 4 is the prevention, and here again, the new emphasis on the airborne infection prevention and control. We know that this TB has been airborne, but now the new emphasis because of COVID on this issue, and obviously the new thing for this plan is going to be the vaccines, which have not been discussed in previous plans. Excuse me. In chapter 5, we're talking about the stakeholders, the community base, the need for communities to have increased funding. We estimate they need 4 times the amount of funding that they're getting right now, looking to community home-based models and looking at obviously the private sector and the new partnerships and the need for new partners. Chapter 6 is a new chapter. It's looking at the pandemic preparedness response, making sure that TB is at the center of this, looking at linking to universal health coverage and the socioeconomic actions that are going to be relevant for tuberculosis. Chapter 7 goes into the vulnerable and key populations, and the human rights aspect is very important. Stigma is something we've always been talking about, but we want to make this also gender responsive and to reach all the key and vulnerable populations. Chapter 8 goes into research and development for the new tools. We want to accelerate this. We want to deliver the new tools. We want to create an environment where research and development is honored, engage the communities in this fight, and then mobilize the resources that are going to be needed. And chapter 9 is going to look at the resources and also the return on investment. We need to mobilize of the $250 billion, $209.9 billion is for diagnosis and care support, with another $40 billion for R&D, and we need to absolutely diversify this funding base. So if we look finally at what can we do? What can this plan do to promote global and country level advocacy plans? As Sahu's mentioned, this is a digital plan. We're not going to be publishing this, although you can download a PDF and you have access to this as of today. In terms of the speakers after me will be talking in detail about the global and country level advocacy plans, but the high level message is that countries will need support and technical assistance to actually do this plan. We also need to develop advocacy material and packages for specific points of the plan for resource mobilization, concentrate on the HLM in 2023 for tuberculosis. And we're fortunate that the G20 for this year is in Indonesia, the following year in India, and the year after that in Brazil. And these are all high burden TB countries. Already in 2022, we had a side meeting on TB financing. In addition to the SDG number 3.3, which specifically talks about tuberculosis, I think we also have to look at the other Of the 17 SDGs, there are 8 other non-TB SDGs that link to tuberculosis, and to keep that in our advocacy message. And finally, the Global Fund is going through its round for 2023, and we need to take advantage of that. So I'll stop there. Thank you very much.
Thank you, Paula, for going through the global plan quick overview. We encourage you all to go through the digital document. There are a lot of details about everything that Paula presented here. Now let's hear the perspective from Austin. Austin, you are the vice chair of our Stop TB board as well. The board endorsed this plan in May. If you can talk about your perspective, especially on why are civil society and TB affected communities at the center of the TB response and the global plan, and how will they contribute to mobilizing the resources and actions articulated in the global plan?
Thank you, Sahu. And let me also join Paula in saying hello to everyone. I can see that we have quite a huge number of participation to this event. First of all, let me congratulate the partnership. I mean, you need very big congratulations for this global plan. And also, especially the global plan task force team as well, and the entire TB community as a whole, because this is a living document and it's widely consulted, because everybody I speak to tells me that they contributed somehow, somewhere in making sure that this plan comes to fruition. I think, first of all, according to WHO data, about 1/3 of people who develop tuberculosis globally are not reached by current health services and systems. So what it means is that meaningful community engagement is critical to improve the reach and the sustainability of TB services, and also to accelerate progress towards ending TB by 2030. So it's not just about mobilizing resources, what usually would, how to engage civil society, but also bridging the gap in service delivery and innovation. And that is what I see beautifully articulated in the global plan. The TB response has also, been biomedically focused, meant that significant work still needs to be done to advance the meaningful engagement of TB affected communities and also civil society, and to realize the person-centered approach as mentioned by Paula in the TB response, because nothing for us without us. And I see this also in the living document as part of the cure. So global plan is quite robust, and I think it articulates most of this. In particular, there is an urgent need to ensure that involvement of TB affected community extends beyond the service delivery, as I said, to effectively, playing a role in forming the TB response, filling the gap, monitoring advocacy for right-based TB response. And you can see around the world now, we have, a lot of innovative interventions, evidence-based platforms being implemented by civil society through the Challenge Facility for Civil Society, and also partly engaged through the Global Fund as well, the CRG Strategic Initiative as well. So these are very encouraging activities that need to be scaled up and not just being prioritized within donor priorities, but to be scaled up in other countries so that we all be at the same level and also at the same table. So generally, effective community involvement yields positive results. It's not just only about, improving case finding, treatment outcomes, raise awareness concerning the nature of TB disease, but making sure that also the resources, because the global plan, a well replenished or fully funded global plan of the Stop TB Partnership will ensure that we meet targets, even the current targets that we're going to be looking at now for the 2023 high-level meeting on TB. Let's not talk about the 2018, because I know that we are far behind target even before COVID-19, exacerbated the whole process. But I believe that we will definitely get there. So we need to practice what we preach by ensuring meaningful voices and involvement of civil society and affected communities in decision-making, policy and program activities at global level, and like what the Stop TB Partnership is doing, building strong regional networks, global networks, and also country networks. And I can tell you that civil society are well-placed, capacitated in terms of making sure that this global plan is implemented at the country level. But what is lacking is the resources. Domestic financing may not cure all this. Global fund replenishment may not also cure all this. We'll probably have to look at how alternative resources, to bridge that gap, because there's a huge gap, even with the global fund resources, with USAID and all that, but there's a huge gap. But I mean, civil society, we are happy with the global plan, and we are also ready to implement, the global plan as soon as it's from today, as soon it's launched. And the good thing is that it's handy. You can access it from anywhere you are. It's not like usually where we used to have a big document without people find it difficult to access it. So I will stop here and hand over to Sahu again. Thank you.
Thank you, Austin. Let me also thank all the TB affected community members who provided input into the global plan, especially those who were serving on the task force. They provided some very valuable contribution. So now let's move to Dr. Teresa Kasaeva. So Teresa, WHO has provided also valuable inputs to the global plan. So your perspectives, please. Go ahead.
So thank you very much, Sahu, and dear colleagues, friends, it's a great pleasure to join you and to speak to you on behalf of the Global Tuberculosis Program of WHO. So it's an important day, and congratulations, first of all, to Stop TB Partnership and to all of us with the development of and launch of the global plan to end TB by 2030. And we must say that it's a unique momentum. We have all the needed strategies and plans and important tools, including guidelines in place. We have NTB strategy with valid, reasonable, ambitious targets. We have UN high-level meeting political declaration and with its targets and progress report. We have now global plan, costed plan aligned with the NTB strategy, as Sahu mentioned, also to guide and drive further our progress. And we've managed to update almost all our critical key guidelines on TB care, which gives much better options. We have finally our new strategy, global strategy for TB research and innovation, and important tools like multi-sectoral accountability framework. Everything is in place. And but as our Director General, Dr. Tedros, highlighted, we will not win and end TB with strategies and plans. Yes, it's true. It will happen on the ground, but we cannot also win without strategies and plans. And at least this task has been done jointly and successfully. Another important point I would like to bring that we are, TB community are united probably as never before. It's another important thing that we have at our advantage, joint advantage. And finally, not finally, probably it's the first, we have dedicated, hardworking community health workers, civil society and health workers on the ground doing their business, really not as usual, but very impressively and providing further progress despite of COVID, and frequently managing with two diseases, with TB and COVID, demonstrating excellent capacity and opportunity to become central in the global preparedness agenda. So these are big advantages and that we have now. What is missing, what is critical? Investments. To move forward successfully, we can't without investments, and global plan clearly indicates these areas, give understanding how much investments and how soon we will need. I would like to highlight specifically that TB research and innovations are quite visible, are prioritized in this global plan, as well as multi-sectoral measures and engagement, and including investments in TB response for successful movement forward. So it's quite comprehensive, and I think it will be also very useful. We're looking forward to the high-level meeting in 2023. We will work together, and we hope that by that time, we still have more than 1 year till high-level meeting. There will be already progress in the uptake and implementation of the global plan, as well as the critical guidelines and other tools. We're looking forward to the new effective vaccines, and these expectations are reasonable. Let's continue jointly advocating for increased investments, and I think that we are closer to the success as never before, despite of all our ongoing challenges. Thank you very much.
Thank you, Teresa. Now let's go to Urban Weber from Global Fund. The global plan resource needs estimates were actually used in the recent Global Fund investment case. So that was good. Urban, your perspective on the global plan.
Thank you, Sahu, and a very warm welcome to all of you on the panel, but especially a warm welcome to everybody around the world, and among those around the world, especially to those who are actually working in providing services for TB, because this is where progress is being made. Let me maybe start with the obvious, and this is to state that the Global Fund fully supports the global plan to end TB 2023 to 2030. So we agree with the roadmap it provides, and we also agree with the outline of the required financial resources. And actually, we are quite proud that we were a member of the task force that was developing this plan. Now today, during these days, it is impossible to speak about tuberculosis without also speaking about COVID, because especially in 2020, COVID had a devastating impact on many of the TB programs that we, the Global Fund, are supporting financially. And many of them, years of progress in finding missing patients have been reversed to a state that we have seen 4, 5, sometimes 6 years ago. To address that, we work with our implementers, and we provide the flexibilities to adapt the tuberculosis programs, so to mitigate the impact COVID had on them. We contributed more than $4 billion to more than 100 countries and to around 24 multi-country programs to support their response to COVID. And this has paid off. Also globally, we are not yet back to the pre-COVID service delivery levels, but anyway, we can see in 2020, we can observe in 2021 of efforts to catch up to such levels in an astonishingly large number of countries. And of course, the Global Fund is and remains fully committed to support this catch-up in a majority of the countries in 2022, and then to scale up essential TB services from there in the years to come, so that we are indeed at the treatment coverage as the plan wants us to be, of clearly above 90, probably 95% in the year 2030. Now, as Sahu mentioned, the TB resource need estimates in a global TB plan have informed the investment case of the Global Fund's 7th replenishment. We need, and this I cannot emphasize sufficiently, we need the support of everyone present here to achieve a fully funded Global Fund during our replenishment conference in this year. And should we reach out to you with a request in this context, then please lend us your hand. If we were successful, a fully funded replenishment will substantially increase the available funding for TB compared to the current cycle. And here we speak about an increase probably in the magnitude of 40%, increase above the current levels, which is already an increase compared to the previous levels. And of course, and finally, we will use all the levers that are available to the Global Fund and in the partnership of the Global Fund that are available to us to increase the domestic funding for TB, for tuberculosis in the countries that we support. Maybe a last sentence just to say that loud and clearly, I would like to congratulate the Stop TB partnership for this very solid plan. And with this, I'm handing back to the chair. Thank you very much.
Thank you, Urban. So that was from the Global Fund. USAID is the other big donor, external donor for TB. We have here Sevim Ahmedov. Sevim, the floor is yours.
Thank you very much, Sahu. And let me also add my congratulations to Luchika, you, Sahu, and Paula for your dedicated leadership in developing this truly excellent global action plan. This report must get on everyone's summer reading list. Unfortunately, it does not make for an easy summer read, and I am glad that it doesn't. And I hope it makes all of us very uncomfortable as we go through the excellent analysis of the current TB situation. Despite TB's no-brainer investment case, and having some of the highest returns on investment, people with TB continue to experience some of the highest out-of-pocket expenditures. And the global TB response remains severely under-resourced. While we are very grateful to our US Congress for its continuous support and funding for USAID's global TB work, clearly, the resource needs and gaps are too large for an individual country or individual donor to fill in. Although it was very disheartening for the global TB community that our latest efforts to increase the global fund allocation for TB, even by a few percentage points, did not bear fruit, we should not give up and double up our efforts and use this action plan for additional resource mobilization and ensure that we do have a very successful global fund a resource replenishment. USAID will continue to play its part. Our donor role is very clear. However, USAID also provides technical leadership and supports direct implementation of interventions in some of the highest TB burden countries. And our TB and health programs are integrated in the largest social, economic, and development agendas that USAID implements. TB both benefits and contributes to the success of these integrated development objectives. What this action plan shows is that our success will require a full society approach. And the three dimensions of USAID's role, the technical, the donor, and the development aspects, amplify our unique position to support the implementation of the action plan. Mobilizing over $250 billion in the next 7 years is a daunting task. As with everything else, however, this also presents an opportunity to act. As the saying goes, opportunities are often missed because they come disguised as hard work. The Global Action Plan did its part. Now it's our time to put the hard work in and help alleviate the suffering and deaths from this treatable disease. Thank you again, and over to you, Sahu.
Thank you, Sevim. Now we go to Professor David Lewinson. David, I know it is very odd hours for you, very early in the morning in the West Coast of US, but your perspective as the chair of the Stop TB Working Group on new TB vaccine and the global plan perspective. Please go ahead.
Great. Well, thank you all. And it is early, but I have to say this is really exciting. And I first want to thank the partnership, particularly Luchika, Sahu, Paula, and Shin for organizing just, I think, an amazing and very collaborative effort that I think really reflects the power of the partnership in mobilizing both resources, but also the kind of the will to get things done. Really, for the new tools group, I think it's clear, and you've all made this clear, that to meet the SDG goals, we really need to both find and cure TB, and we also need to prevent it. Obviously, early detection of TB will blunt transmission, and a vaccine would prevent progression to disease. And one of the things I'm especially proud of is this is the first plan to focus on prevention, including a chapter on vaccine implementation, which a cost estimate about $52 billion over the course of the plan. And with a lot of thought, not just to the cost of vaccine availability, production, et cetera, but a lot of thought to community engagement and how do we sort of set the stage for an effective vaccine rollout. And to me, that chapter really, I think, really embodies in many ways the power of the partnership and kind of bringing people together. I'd like to sort of just highlight that this is a really exciting time scientifically for TB. And sometimes I think we in the TB space can be a bit gloomy, but right now we have science that supports vaccine efficacy as reflected by the development of the M72F vaccine, which has a roughly 50% efficacy, which our modelers show can have a profound impact on the TB epidemic worldwide. We have tools that are beginning to either detect TB early or in a subclinical state and might possibly even detect the probability of progression. And we're seeing the development of shorter drug regimens and new medicines. But at the heart of this is really advocacy and community engagement to really achieve the development and deployment of these tools. I think COVID, as it's been mentioned already, has reminded us of the power of public-private partnerships, along with a shared sense of urgency in mobilizing the resources needed to rapidly develop effective diagnostics, therapeutics, and vaccines. And in my perspective, this has been a scientific miracle in many ways. But I want to sort of take a step back and talk about the M72F vaccine and sort of highlight the ways in which we really need to come together as a community. So the actual scientific underpinnings of the vaccine were actually took place in the late 1990s, followed by a series of multiple both animal and then early stage clinical work. And then followed by 2 New England Journal publications, I believe in 2017 and 18, showing the efficacy of this vaccine. So here we are in 2022, and the phase 3 trial for that vaccine is slated to start next summer. That, if you think about that with the perspective of COVID, is absolutely unacceptable. We can't allow an effective vaccine to sit on the shelf for literally 2 to 3 years. So what this highlights to me, and I think it's the real power of this document, is really the need to mobilize around the resource needs and develop that sense of urgency in bringing our new tools, especially vaccines, to the fore. I think we estimated a total of about $40 billion for new tools. And I think if you compare that to COVID, that's a gross underestimate. I'd also love to just draw your attention to the work that was done by David Dowdy and Teresa Reichman, who developed figure B, which is the cost of inaction. And that's a really gorgeous figure in the sense that what it articulates is not just the impact of new tools and new vaccines, but also the cost of delaying the development and implementation of those tools. And what they suggest is that if we fail to develop those new tools, both implementing what we can do now, but also developing novel tools, we estimate that we could have presented over 30 million cases over the course of those 8 years. And that's a staggering cost of inaction. So I think I'd like to conclude there and just sort of really congratulate the partnership, I think, on what's turned out to be a fantastic document, and to really support a shared vision for TB elimination. Thank you.
Thank you, David. Now we have Dr. Alok Mathur from the National TB Program of India. India, as you know, has a very ambitious target of ending TB ahead of the global target. So Dr. Alok Mathur, your perspective on the global plan. The floor is yours.
Thank you, Suvanan. As you know, India being one of the high TB burden countries is hugely impacted by TB-related morbidity and mortality. In our endeavor to address this global disease, we are proactively working towards ending TB by 2025, 5 years ahead of global end TB target of 2030. Our national program for elimination of tuberculosis is backed by high-level political commitment, which has resulted in large-scale advocacy, community involvement, and up to threefold increase in domestic resources for TB in last few years. The global plan to end TB document, developed by Stop TB Partnership with contribution of partners and domain experts, provides a blueprint of priority actions required and a detailed estimate of financial resources needed to end TB as a public health challenge by 2030. The document also advocates for the need to scale up, mobilize, and invest greater resources for TB elimination. I would like to highlight that in India, we are already working towards the same with increased domestic investment, corporate social responsibility funding, and adopting innovative financial mechanisms like loan from the World Bank and loan buy down from the Global Fund for TB, reiterating countries' commitment to end TB. We are deploying multi-pronged strategies to accelerate national response to tuberculosis, guided by our national strategic plan for TB elimination 2020 to 2025. The country is hugely investing in population screening to scale up TB preventive therapy, developing cost-effective screening tools, universal access to quality TB testing and treatment, TB vaccine, that is very important, TB vaccine research, and strong community and multi-sectoral engagement efforts. Let me apprise you, India's plan to prioritize TB and cancer cervix during its G20 presidency in 2023, which our Honorable Health and Family Welfare Minister had shared in 35th Stop TB Partnership meeting as well. So this clearly depicts that addressing TB continues to remain priority for India. There is no doubt that the global plan to end TB document will guide us to revisit our funding needs to end TB in India and advocating further to government, donors, and partners for our amplified funding needs. I congratulate the Global Plan Task Force members and the Stop TB Secretariat for this very important and timely work. Thank you so much. Over to you, Suvanan.
Thank you, Dr. Mathur. And thanks also for mentioning the G20 India Commitment 2023 presidency of India, that India will prioritize TB amongst the diseases that it will prioritize for 2023 G20 agenda. Now we have Philippe Chacon, who is from the Stop TB Private Sector Board, the private sector constituency of the Stop TB Board. So, Philippe, your perspective from the private sector, please go ahead.
Sure, Sahu, and thank you very much for giving me the opportunity. First of all, I want to start by saying that the private sector fully supports the new global plan to end TB. As you know, I was also a member of the task force, and as such, I want to commend both Paula and you for your leadership and the efficiency in running the process. I think that's been very well done, and the result is at the level of all the efforts that we've made all together. The private sector continues to invest in TB, developing new tools and new technologies for screening, for diagnosing TB, including digital X-ray, artificial intelligence, and molecular diagnostics, filling the current gaps and playing an increasing role in antimicrobial resistance and pandemic preparedness. A good number of new drugs are also both in the discovery and the clinical pipelines, and the new generation vaccines are also in development. That shows the appetite that the private sector continues to demonstrate in support to the fight against TB. However, to reach the goals that we've put ahead of us, new tools are not enough, and we urge governments to take action to accelerate adoption and increase funding for implementation and to support R&D, not to forget the urgency to remove trade barriers, tax and duties that prevent the development of the much needed public-private mix, as some of the previous speakers have mentioned. I don't want to take too much of your time. I think these are the main messages I wanted to share, but let me just end by saying that the private sector is committed to contribute to the success of this ambitious global plan. Thank you, Simon.
Thank you, Philip. So now the speakers have all spoken, so we will open it up for questions or comments. I did not see any questions in the chat. It will be good if you can speak up, because we have interpreters who can translate it simultaneously. So if you have any comments, questions, please raise your hand, and then we will listen to you, and then we will respond to the questions and comments. I see Francisco. Francisco, please go ahead, and followed by Francisco will be David. Yeah, go ahead.
Saludos desde Chile, estoy hablando en español para la traducción. Quisiera preguntarles al panel, este nuevo plan global, ¿de qué manera enfrenta el alto riesgo que tienen los pueblos indígenas de todo el mundo frente a la tuberculosis? Muchas gracias.
Thank you. So let's take a few comments and then we will respond. David, please go ahead.
Yes, indeed. It's so nice to see TB colleagues again. I'm with the Frontline Health Worker Coalition now, and I wanted to ask a question about human resources for health. I see in the prevention chapter, you highlight human resources and the need for sufficient training and retention of health workers. Do you have a resource needs estimate for that? I would imagine with increased contact tracing, provision of preventive therapy, more human resources could be needed. Do you have an estimate of that requirement in prevention or in other areas? The context of the question is a real crisis amongst health professionals and community workers as well. Many health workers leaving countries, migrating elsewhere to wealthy countries due to poor working conditions and unreliable payment, and community workers also face many challenges. That was my question, and thanks again for this fantastic plan.
Thank you, David. Let's take one more question, then we will answer, then get back to more questions. Subrat, please go ahead.
Thank you, Dr. Sao. It's not a question, it's just a comment. First of all, congratulations, partnership for this global lunch. I echo what Austin said very clearly, and a few others, that this global plan actually giving us an opportunity for civil society and community to go for larger advocacy at different levels. Thank you so much for this opportunity for civil society and communities. Over to you, Dr. Sao.
Thank you, Subrat. So before we go to the next set of questions and comments, I see one in the chat as well. Maybe we address once. So I will start, and maybe Paula or anybody else who was on the task force can add. So the first question on indigenous community, yes, indigenous community is part of the key population. The global plan articulates and defines key vulnerable population. It is similar to what was in the past, but some things have been added to it. One important thing that has changed is instead of calling the whole group as key population, now it is being called as key vulnerable population, and the definitions remain the same. Indigenous population, indigenous community is a key vulnerable population. Many of them have high rates of TB, as we know, even not only in high TB burden countries, even in low TB burden countries, you may have seen reports of them having high TB burden. So there are special needs of this community which needs to be addressed. So yes, that's a priority group articulated by the global plan. Maybe if there is James or anybody else from the task force who can talk a bit more on this, can also add. Let me go to the second question from David, which was on the human resource for health. David, in the past, your hat was on TB, but now you are with human resource. So that's a very logical question. Yes, that's a critical need in TB. However, you will not find a separate budget line in the global plan to estimate the human resources, because every country has different systems of how they budget it, but they are all included into a group called program costs. In the disaggregation, when you see, there will also be an annex to the global plan. I wanted to point out that the annexes were not ready with the designers, so they are not yet there. But in a few days' time, maybe this week itself, you will find the annexes there, which has more details. So there is a breakup of, and in the breakup, you will find this program cost, which covers the human resources. But the answer to your question is we didn't have a separate budget line on human resources. Anybody wants to add anything to that? No, so let me go to the next set of hands raised. No floors, please go ahead.
Buenos días, muchas gracias por el espacio. Noé Flores desde Honduras. Mi consulta es sobre si tienen estipulado alguna sección para las poblaciones migrantes, considerando de que tanto América como África, Europa tenemos mucha migración y es una población muy importante en la lucha contra la tuberculosis. Muchas gracias nuevamente.
Thank you. I think the answer to that question is short, so let me tell you, yes, it is there, and it is in the same key vulnerable population section of the global plan. Yes, they are a vulnerable population, and they have special needs, and the TB services have to reach them in a sensitive manner as well. There are different kinds of migrants as well. And there are also reports of how the migrant population as a proportion of the total global population is also increasing because of displaced population due to different reasons, including wars and civil unrest and so on, and economic reasons as well. So the next hand I see here is Timur. Timur, please go ahead.
Yes. Hi, everyone. I'm trying to turn on my camera. Yeah, I'm outside, so sorry. First of all, congratulations. It's an amazing milestone. I just hope that we had also a global plan on resource mobilization to end TB, because I recognize the enormous contribution of the global funds, the enormous contribution of several donors, but I don't think we will be able to close the funding gap with those resources. So we need to ramp up our efforts to raise more resources in order to make the global plan the reality. So I just want to highlight that, and probably there should be some follow-up, and there will be some follow-up, but I think this follow-up needs to be more in scale, so to say. Maybe as a supplement to the global plan or as an immediate follow-up to it. Thank you very much. Over.
Thank you, Timur. I think that's a good suggestion for a resource mobilization plan. The global plan does talk about different sources of resource mobilization, but the plan would go into more details on how to do that. I see Karam Shah next. Please go ahead.
Yeah, thank you very much, Saul. Again, I'll add my voice with our colleagues and congratulate Stop TB Partnership and the stakeholders for bringing this incredible plan. Just referring back what basically Temu was mentioning about the resource mobilization, we understand that there's a huge gap, and Global Fund is basically the main platform where most of the donors are putting their money. So I think one of our tasks as partners would be to add our strong voice and advocate for the replenishment of the Global Fund next replenishment event. So my suggestion would be, and I seek advice from Urban is there in this call. So how do you see that at the country level we can support the advocacy campaign for replenishment? Like, for example, as a civil society, Stop TB Pakistan, we are thinking of having a huge event here in Pakistan, bringing all stakeholders together, media and celebrities, and of course the political elite, and asking for their support for this replenishment. Can we do that? And is there any basically worth doing this exercise at country level? Thank you very much.
Thank you, Karam Shah. We will take the two other questions also and respond to it. And so let's go to Rachel first.
All right, thank you very much. For the benefit of those who do not know, I'm Rachel from African Coalition on TB. And my question is, how will we ensure political commitment to vaccine is a reality, taking the fact that COVID-19 experience and lessons, because I believe it's achievable. And also, I love the vaccine call out, because in my place, we say that prevention is more important than cure. So how do we ensure political commitment to vaccine production is a reality, taking that COVID-19 experience and lessons, because I believe it is achievable. I don't know if my question is clear.
Yeah, thank you, Rachel. Muzammil, please go ahead. Muzammil, if you are speaking, we don't hear you. Maybe you are muted.
Hello.
Yes, we can hear you. Go ahead.
Hello.
Yes, go ahead. Go ahead, Muzammil, we can hear you.
He's back on mute.
Maybe Kerry, if you can unmute him.
I have tried to, I've sent an ask to unmute, but I can't unmute him myself. All I can do is ask him to unmute, but.
Okay, well, we wait for Muzammil. Maybe we can respond to that question on Global Fund replenishment. Urban, do you want to respond to that question?
Yeah, sure, quickly. Karam Shah, thank you for supporting us here. I mean, the replenishment conference is well underway. I mean, the preparations for the replenishment are well underway. And personally, I'm on the spending side of the Global Fund. I'm not on the income side of the Global Fund. So if you would get in touch with me with your suggestion, then I would ensure that it's being forwarded to donor relations, and from there we would work further with that. So more I cannot say at this point. However, more in a generic way, we are getting from our donor relations once in a while requests for information, for participation in certain events or whatever. And whenever this is related to TB, we might ask individuals or organizations here present to either for a statement or to join events or whatever the case may be. And it would be very helpful if you could support us in such cases where this might come up. Thank you.
Thank you, Urban. We have reached the end of the the hour, but there is interest, so maybe we continue a few minutes. And Ruchika is also here. She was she will end the meeting with her concluding remarks. But before that, Ruchika, if you are okay, we can quickly take 2 questions, and we have to respond to the question on the advocacy as well. So Lizzie, please go ahead.
Thank you very much. Mine goes to Felipe Jacon. I've seen how passionate he is with the private sector investing in TB. My question is, how do we integrate all those efforts that have been put in place by private sector so that we can, look at benchmarking on the next steps towards the goals that now we're setting and looking into as of Vision 2030? How do we integrate all these other tiny efforts that other private sectors are putting in towards the fight against TB?
Yeah, do you want me to take it quickly, Sahu?
Yeah, we have one more question. So
okay, go ahead.
Yeah, so Uzma, so let's take this as the last question. Uzma, please go ahead.
Okay, thanks, Sahu, and thanks everyone involved in developing the plan. It's very comprehensive and excited, and I especially liked, if I can say, the bold people-centered and decentralization and community-based models. Without having an opportunity to go through the details, but from the overview that was shared today, it would be good to understand from the group that if you think the allocated investment to implement this people-centered approach is enough for TB treatment, especially for children and for the 2.2 million targeted for drug-free TB by 2030. And if I can just add, another thing that I would like to ask is, does the plan include any investment in country TB laboratory network? Because we talk about diagnosis, and I understand we can't put everything in it, but when we talk about implementation and other resources in terms of optimal treatment, it's really that's one of the biggest gaps in terms of care delivery models. And so if there are any thoughts around that, especially with related to the laboratory systems itself to monitor patients, but also creating connectivity solutions that as new tools are being rolled out. Thank you very much.
Thank you, Uzma. I didn't understand the 2.2 million you said about.
The 2.2 million, I think Paula in her presentation had the number of people with drug-resistant TB who would be treated by 2030, the estimated.
Okay. So we have 3 things to respond to, this one, and also the one that came earlier on the political commitment and the one on the private sector. So maybe, Philip, let's go to you for the private sector one first.
Yeah, okay. I'm going to be brief because I don't have a full response to the question, which is actually, I think, critical. And the only thing I can say is that we continue to see that despite the fact that we see new products being endorsed by WHO for TB, every time we see countries having to go through their own validation steps, and this certainly is not helping with rapid integration of new tools. So we see that by the time the WHO endorses a product to the time the product is really used on the ground, there are certainly a few years that go by. So if there is any action that I would say is very important for the future to accelerate adoption of new tools, is to maybe trust what WHO and other players are doing, look at maybe best practices in certain countries, and do not have every country repeating the same kind of studies to demonstrate the value of the tool. That would be my recommendation.
Thank you, Philip. To respond to the political commitment question from Rachel, I think that's an important one. We saw in this webinar the commitment that is there in India, right from the level of the Prime Minister of India. So I think that is the kind of political commitment that we need in all the high TB burden countries. And from Stop TB Partnership, we are happy to work with partners to seek such opportunities to build political commitment at the highest level. I think this is key. And there are some opportunities coming up. The UN high-level meeting mentioned by Teresa on this webinar, which is next year. Also the G20, you heard about India. The current presidency, Indonesia, is also highlighting TB, so there's an opportunity. And I must say that Africa Union is also an opportunity which is not fully tapped. So we will be working more with the Africa Union and actors in Africa who can build further political commitment in Africa. I would, so there's one more question from Uzma. So I think that will require a detailed discussion. Uzma, is it okay if we take it offline? And I think your points are important, not just the laboratory, not just the test, but the laboratory network and so on. So yes, they are all included in the global plan, but may not be very explicitly mentioned because it's a document which is very high level. But maybe when we translate that at the country level, when the national strategic plans are developed, those elements have to be captured in much more detail in those plans. I think now we should close the question and answer session. And Luchika, if you are there, I see you are there. Over to you for the closing remarks.
So thank you so much. Of course, I am here. I always value the time of people, and we have more than 200 people. We reached almost 300 online. I also appreciate because it looks like people listened and valued this. I think we all have we are a bit tired of Zoom and not being able to meet each other and so on. It was an amazing panel, and I'm really grateful because everybody brought their own angle in this. The work is just now starting, to be honest with you. And I know that Paula and the colleagues that were in the Global Plan Task Force, and you, Sahu, and Sheen, and the others probably are like, she's crazy. I know that you don't say that because we all think the same. There are two parts to it. One is indeed the advocacy and the expectations that basically colleagues at country level are driven, as Teresa and everybody said, by the same ambition and the same way of looking at things as we see in this global plan. As a community, TB always tried to fight TB with very limited resources, and that's why there is a sort of shyness, self-limitation sometimes observed in some countries. I think it's less and less, and we need to make sure that we all think and speak in the same time and push in the same way the agenda forward. So that's why the advocacy part of it, the unpacking this at national level, the points that Shannon was making, the looking, the basically ensuring that the level of ambition observed here, as well as understanding that what type of resources and what type of tools we have to deploy in order to end TB, or in order to bend the curve enough that we are having less of a burden of TB. We will not eradicate, we will not eliminate it, but for sure, we will be able to end TB. I'm very happy to see that there is a very active interaction on the chat. It gives me a lot of hope, and I think everybody that this is very well received. I know that we are 11 minutes beyond the time. I am very grateful for this. I'm very happy we launched it. And I think we have to go full speed ahead to be able to end this disease by 2030, as we promised. We owe that to ourselves, but more important to the people coming after us, because I think we are the generation the closest to achieve this dream. So thank you very much, and let's go ahead. Thank you.
Thank you, and thanks for joining. And see you again in another format, in another meeting. So till then, bye. Bye for now.
Thank you so much.